Hello, this is Chris Hampton with USI Insurance Services. We have partnered with Leading Age this year to bring you a better clinic known as Nice Healthcare. During this presentation, we'll be talking about what Nice Healthcare is and how it could help your organization in reducing your cost in your health insurance plan, plus give your employees better services along the way. The question is, what is Nice? Nice is a primary care clinic that brings free medical visits, medications, labs and imaging, physical therapy, and even mental health to your employees for no cost, while also reducing your claim spent on your medical plan that you purchased through your organization. Traditionally, how people use the doctor is they go to their network clinic they go to, or maybe a virtual visit that you might have for the day-to-day type things. But Nice Healthcare is really a wrap-up of a clinic and a virtual clinic all in one. It's convenient, effective, and affordable, which is very different from your traditional in-network clinics that are not Nice. So the three big bets behind Nice's direct primary care model, they're betting on three things happening. Bricks and mortar are kind of vanishing. Virtual clinics have become very popular over the last few years, so this takes virtual clinics a step farther. Fee-for-service pricing is broken. All Nice services are provided under a fixed per employee per month rate that you would pay at. The nurse practitioners provide exceptional care. The Nice clinicians are full-time W-2 employees practicing at the top of their license. So what does Nice cover? We like to call it the Nice patient experience. We really look at three areas: wellness, acute care, and chronic care. One good way to look at it is frictionless primary care. So everything that you do on a day-to-day basis in a clinic can most likely be done through your Nice Healthcare provider, either during a virtual visit, an in-home visit, or a worksite visit. Stuff you can do for it is things like healthcare assessment, baseline biometrics, RX review, those types of things. For acute type things, strep, ear infection, all those labs are done. Chronic conditions, if you have hypertension or diabetes, that can get treated through your primary care option through Nice Healthcare. Physical therapy can also be done with strains, sprains, arthritis, and so forth. And then mental health, depression, anxiety, and so forth. Also, there's a pharmacy component to it. So there's over 550 free medications for acute and chronic conditions. I'll give a couple of examples how I've used it myself as we go through the presentation. Very slick, very easy, and very fast. So how does it work? Step one's pretty easy. All you have to do is download the Nice Healthcare app on your smartphone that you have, or you can get on the computer and use that too. And then patients will start, takes about 5 minutes to enroll in the app and put your information in there once you have got it for your organization. Patients start with a chat or a video, talk about their diagnosis, prescriptions that they need, any referrals or physical therapy, and those types of things. A lot of times, the virtual visit or the chat portion of it will be sufficient enough, but if not, if needed, the nurse practitioner will travel to you. So they'll travel to your either home, if you're in the required service area, or to your place of work. Stuff that they can do in person are free labs, free x-rays, free physical tests. I myself just had a physical done at my home last Friday. Very convenient and fast. They came in, answered some questions for them, took some blood work, just the regular lab that you get back. I had my results back in less than 24 hours from the lab. Went through some family health questions and those types of things too, and some hints on how to get a little bit healthier, those types of things, and got me my physical that I need to get through my employer each year. So it's very, very easy, very fast. I think the total probably took about 15 minutes. I didn't have to go anywhere. They came right to my house, which was very, very convenient. Also through NICE, there is a NICE pharmacy program. This works great. So any thing that you need to get as far as a prescription from either a virtual visit or an in-home visit or worksite visit, or just something as simple as a refill on your current prescription that you're getting. I utilized this a few weeks ago. I called in to get a refill on a sleeping medication that I take, and it was really slick. All I did was engage NICE through the chat portion of it, told them what I needed. They set up an appointment with me about an hour later, where the physician assistant called me and just asked me a couple questions about the medication, how long I've been on it, and those sort of things. Asked me which pharmacy I wanted it sent to, and it was done. I got a nice 90-day supply in the mail. I think it was about 7 to 8 days later that I got it. So very convenient, and it didn't cost me anything. It was completely free, which is really nice because that prescription was pretty inexpensive anyway, but I think it was like $4 a month. So saved me a little bit of money also. There's also free virtual physical therapy included. So you meet with a NICE provider, you get a referral, meet with a physical therapist, and it's all done with the NICE app. Very convenient, and of course, there's no cost to that for the employee. So why employees choose NICE versus traditional clinics? They have a choice. First of all, it's convenient. So you can use virtual care. They come to your home or into your work site that you want them to. You know, traditional clinics where you go in and there's nothing wrong with them, of course, but you go in and check in and then sit and wait for the doctor. The doctor comes in for a couple of minutes and that's it. And those visits usually cost, $120 up to $220 to do that. This is very, very convenient. Almost all the time you can get in right away and talk to somebody, physician assistant, or someone will come to you in that day. Multi-person visits, you can talk to the same person time after time. Of course, we have a formulary list for prescriptions, and home visits are included, which you don't get in the traditional clinics. But I would say overall, it's just a very convenient, very affordable, because it doesn't cost the employee anything to engage in these services once you purchase it for your organization. And it's very comprehensive also. So additional support and resources, once you agree to put this in for your organization, provide marketing materials for you quarterly and annually reporting, so you can see how many people are using it, what they're using it for, of course without the names, and so you can see what the value you're getting from it also. Also how to engage. So we have a lot of materials on engagement strategies of how to get the employees aware of what actually is happening. So as I said earlier, we have really two missions here. First of all, it's to provide the employees with a no-cost alternative to going to the doctor. Okay, you can see on this chart, NICE is $0 compared to a regular minute clinic on a strep throat visit. You're charged about $158 for that. Traditional clinic, you'd be $242. And urgent care, right around $300 for a strep throat test. This costs nothing. What's nice about this also is all those claims dollars, of course, you as an organization are purchasing medical insurance. All those claims dollars, when people go to the doctor, are included in your medical insurance claims, which goes to your renewal costs at renewal time. All of these claims are pulled out, so there's nothing that's processed through insurance. So your insurance is not credited with any of these, and so you end up saving money on your renewals year after year also. Here's another example, someone with a chronic condition like diabetes. Cost nothing through NICE for the employee to get the care there. Minute clinic, about $232, and traditional clinic, about $240. You can see the time there too. There's no wait time or travel time or anything for the employees, which is really nice. And also the prescriptions are included in it, so there's no cost for the prescriptions also, which makes it even more affordable because there's no cost, which is great for the employees. So what's included with Nice Healthcare? Think about it as a virtual visit on steroids, because it also includes home visits, or if it's more convenient for the employee, they can actually come to the place of employment and do the visit also. Hopefully this will help your employees save some time off of work also, by having to go to the doctor. Maybe they're more productive at work for you, especially everybody in the leading age categories. We know that presence is required to do the job most of the time. So hopefully it will help on lost time also. So what's included? The ability to chat or video visits with your physician assistant through Nice Healthcare, and home visits are included for worksite visits. 35 plus labs are conducted in the home for no cost. Over 550 medications, and our list keeps growing, is included. Virtual physical therapy, in-home x-rays, referrals to specialists if need be, well-being and pregnancy support, chronic disease management, and e-prescriptions to your pharmacy if they do not carry the drug that is needed through the prescription. Accessing Nice is very easy. Extended hours for a little more time. So Central Standard Time, which we're all on, Monday through Friday, 8 a.m. to 7 p.m., and Saturday and Sunday, 9 a.m. to 12 p.m. So you got some good times for online visit hours. Of course, home visit hours is a little less convenient, but it's Monday through Friday, 9 a.m. to 5 p.m. for those in-home or worksite visits that you may have. So getting started with Nice is really easy. Contact myself, Chris Hansen at USI, and I can give you more information how to get started with this. But basically, we get a quote from Nice Healthcare to see how much it's going to cost your organization. Usually runs between $30 and $40 per employee per month. Here's the nice thing that's the real kicker here is that through your medical insurance, we actually get up to 3% off of your medical insurance rates when we put Nice Healthcare in. That helps, of course, offset some of the cost of purchasing Nice Healthcare. So almost all the time, it's free to put it in. But then what we're also trying to do is reduce your claims on your medical insurance, which is going to help you on your renewal numbers and be able to afford that really good care. So lots included. Of course, we went through a lot of information during this presentation. We wanted to make it short and sweet, and hopefully you got a lot of information out of it. So obviously, through this presentation, we learned a little bit about Nice Healthcare. We really wanted to provide this service to all the leading age members because we value your partnership, and we work with a number of you already, and we like to work with more of you, of course. If you have any questions, I would love to answer them for you. You can contact myself, Chris Hansen at USI. You can email me at chris.hansen@usi.com or give me a call on my phone, 612-387-7099. If you listen to the presentation, if you have any questions, please feel free to reach out, and I'll reach out as soon as I can right back. Thank you very much, and have a great day.